They're looking for instant gratification because that's the way their life, revolves right now.
But who's going to tell you? The TV's not going to tell you.
It's sad, actually, and I don't see it getting any better.
I basically told her, you're gonna die, you have family, you have kids. Pills get someone, they get someone,
Right now my heart's going like this. My name is Jasmine. I have a minor form of OCD and I suffer from severe anxiety. I've had anxiety pretty much since I can remember, probably 10. My mom took me to just the general physician and we started, my mom said, explain to her, what do you have and all that, and I'm like, okay, I told her, and she's like, oh, okay, here, take some Paxil. Like that, take some Paxil. You'll be fine, it'll cure you. We went on vacation and I forgot it. I forgot my Paxil. All of a sudden, I start getting anxiety and freaking out because now I don't have it. I could not believe how much I depended on it.
Well, they said I was the best trauma patient I ever had because I was laughing and joking even though I was on morphine. Because I knew I was alive, God saved me. So even though I was messed up, I knew. So I'm alive and I'm going to be alive. So I was pretty damn happy, even though I was in extreme pain. Had to put my hip back in place. That was the worst pain in the world. My name's Carlos and I suffer from a few different ailments. I went in the Army just because I wanted to finally have a career. So I left there in late August '02. Went to Iraq in January '04. I was in a Humvee accident. The Humvee I was in missed a turn, fell on an aqueduct, fell about 20 or 40 feet down. It was on top of me for like 3 hours. The guy next to me got killed. I got stuff to sleep for my PTS, post-traumatic stress disorder. I've got some pain medicine over here, some hydrocodone, acetaminophen, whatever it's called. Which one's what? And I got some Zoloft for depression. Quite a lot of stuff.
Prescription drugs have a focus. They have one thing. They control, high blood pressure, and they have a tunnel vision for that, and they may do that. It may lower the blood pressure, but then it exerts a whole bunch of problems on the rest of the organism.
Side effects may include dry mouth, insomnia, sexual side effects, diarrhea, nausea, and sleepiness.
Actually, they say that sexual certain ones, they say the Zoloft, but it never did anything for me. But now I took the other one, combination, and maybe that happened. Now I'm less motivated when it comes to that area.
I think our culture, we live in a culture of fast solutions. That we're kind of it's a mixed culture, we want everything drive-through. Give it to us fast, give it to us, we want the quick answer. And that has caused people to think that, well, if I'm really unhappy, rather than looking at what's going on in my life and making changes and developing coping skills, I'd rather take a pill.
I'd be down for any kind of medicine, be a guinea pig, I don't mind.
For me, right now in my life, I don't want that quick fix, but I want an answer. I want to know if there's any alternatives that I can take that will help me. We are going to see a homeopathic practitioner, and she has some new type of machinery that is going to give a read on my health, a variety of things. So we are going to go see what it says. Hopefully something good. Anything that I haven't been pre-exposed to or known about, told about, I want to find out.
One of the reasons why I really wanted to stop taking Xanax was I worked at a radio station with a friend of mine who suffered from very deep depression. And I remember her telling me a story about her being on Xanax for long periods of time, as well as Paxil, cooking a grilled cheese at her apartment, sitting down at the kitchen table while she cooked the grilled cheese, falling asleep, and waking up 3.5 hours later with the stove on fire. My name is Whitney, and I used to suffer from debilitating anxiety. The first time I acknowledged that I had anxiety, I had a full-on panic attack. And, you know, I determined that it was because of a circumstance in my life, something that had happened to me. My boyfriend was killed in college, and so I went through a lot of anxiety because of that experience. But that was the only way I'd really acknowledge it, or even my family would acknowledge it.
Some of the psychiatric medications are the most toxic medications you can take, besides possibly anti-neoplastic medications, anti-cancer drugs. They can be very harmful, they can be very toxic, very potent medications, and to prescribe them willy-nilly is not good.
I was prescribed Xanax, and I did take Xanax for a period of time. Unfortunately, it was a lot like taking a narcotic, and I just felt doped out all the time, and it was awful.
I think there are certain ways that we can naturally enhance our serotonin, and natural ways to improve depression. Things like exercise, things like relaxation exercises, making sure you get your sleep cycle set.
It kind of all came to a head when I just realized that I was unhealthy inside and out, and I needed to take care of myself. I decided that I was going to try to combat my anxiety, my excess energy, with exercise. And that really helped me, probably more than anything else I can possibly say.
And I read this definition once of power, that power is the ability to transform yourself, the ability to heal yourself. Then I think people would probably flock more to alternative treatments, truly, because they'd really be able to truly tap into their potential.
We normally get 10 less sets. Very good. Beautiful. How'd it feel?
That cures anxiety. Hello.
Yes, hi.
How are you?
I'm good. How are you?
Nice to meet you.
I'm Wendy.
A friend of mine's mother happens to be a homeopathic practitioner.
Okay.
He had told me that she had just got this machine, you know, it tests to see what you're imbalanced and, you know, just a bunch of different stuff. She took my pressure points on my fingers and my feet, and it showed I was extremely high when it came to, so many things I was way over. She put me on a bunch of supplements. You know, the machine showed what I needed to take that would bring me back to balance. I want to see if there's a change in my diet, if I get the supplements that I need, if I do what I'm supposed to do, then maybe, yeah, there will be a difference.
I was just scared out of my wits, but, well, anyway, thanks.
Not at all, Miss Barton. That's what I'm here for.
She was about, I don't know, she was in her teens. And she looked at me with these big old eyes and she said, "Am I retarded?" And I know. I was like, no. You know? But so I had to explain. And I'm thinking, at that point, I was like, oh my God, we never explained this to her.
My name's Tracy. I'm diagnosed with anxiety, like a small form of autism and depression, ADHD.
She went to every psychologist, psychiatrist, clinic, doctor, pediatrician, anything I could find in this valley that would listen to me, that something just wasn't right. They told me very early on that she would never graduate high school. She would never go to prom. She would never, never, never is all I ever heard. And my reaction was, over my dead body. I'm going to prove you all wrong.
I had a cookie with frosting on it, with sprinkles on it.
Oh, yeah?
Yeah.
Where'd you get
It was just ironic that all through her elementary school years, all they recommended was give her a pill. They never recommended any other kind of intervention for her whatsoever.
What I've learned is that I trust my pediatrician for ear infections. If my kid has a fever, if my kid has a physical problem, I trust what my pediatrician has to say. I don't think pediatricians are really trained in any kind of research-based understanding of emotional development, child rearing, parenting issues.
My daughter Tracy, who is now 23 years old, and a student at college, when they said it couldn't be done.
My dean's list twice. I also made the Kappa Delta Pi Honor Society. I guess you have to get a certain GPA, and I made straight A's twice in a row in my classes.
She has learned now over the years to just do this drug-free. She knows what she needs to do. She knows if things are too stimulating for her, that she needs to get to a quiet place.
I usually, when I'm just having some bad days, I'll just go take a walk, or I'll write. I'll play some music.
I think that if the word gets out and the society finally understands that there are other ways to heal whatever problem they might have than just one solution, that they will start to push the ball rolling.
Don't take what they say as face value. Be your child's advocate. Don't, that's just, I can't get that message across enough to these parents. Don't, what they tell you, this is what's wrong and that's that. No. Research, research, research.
By doing this, it would help my anxiety. By doing this, I'd feel better. I'd get more sleep. And I'm like, yeah, right, whatever, we'll see. These little herbal pills, okay. So I start taking the herbal pills, like Emmy, which is supposed to help my immune system, one that's for my digestive, just, a variety of herbal supplements. I've never felt so better. And I'm not just saying, even my mom, my family, they're like, have you been working out? I'm like, well, I've been more active, but no. And they're just like, your color's back. This is the first thing my mom said, like the third day after taking all these herbal supplements. She's like, your color's back. And I felt like my color was back.
That's good.
Accuracy and skill are synonymous with pharmaceutical technique. An error in the compounding of a prescription could be injurious or even fatal.
Humans are becoming commodities, subject to unprecedented engineering and experimentation.
I talked to my sister and asked her to get away from the pills. She just couldn't do it. She just wanted more and more of them, I basically told her, you're gonna die, you have family, you have kids. She left a 4-year-old son. Name's Rick Bade. I'm here to talk about a family death due to pills. They said that she was bipolar and schizophrenic, and said that she was manic depressant. We'd basically go to the doctor, whatever, she went there for, and, insurance would take care of whatever she was there for, and she would get pills as a result, and, she would take her pills and get messed up.
Family practice doctors, internists, general practitioners, even OBGYNs are trained and skilled at prescribing psychotropic medications for things like depression, anxiety, and other psychiatric disorders on a primary care level. And so, we do feel comfortable in prescribing medications for those common disorders.
Do I want my, obstetrician prescribing me oncology drugs, chemotherapy? I'm going to go to oncologists if I have cancer. I'm not going to go to a psychiatrist to prescribe chemotherapy for me. Why these doctors think that it's just like candy, doing Prozac, and it's dangerous.
How could you just give continuous pills to people constantly if you see history like that?
In many circumstances, the drugs are very powerful, and we need drugs, of course, to heal different disease states. They're so overly abused that the doctors wouldn't even consider truly what the infection was going on as to what prescription they would write.
I feel like it was more of a just her way of getting what she wanted, like had some pills, and basically they were her, you know, suppliers right there, you know, and I think she liked the pills, and I think she learned how to talk to them, I think.
I think that doctors do a great disservice to their patients when they don't either refer them to a psychiatrist and or just as intensely recommend counseling of some sort for them.
She went to sleep, and that was it. Found her the next morning.
I mean, it leaves everybody else wondering why and what they could have done different.
Yeah, what you could have done different, or how you could have handled it different. There's a lot of blame towards doctors and psychiatrists and stuff because they just handed over whatever she wanted.
And then the doctors and the psychiatrists blame the family.
You're popping a pill, you're masking the symptoms, and that's it. And you're not really healing yourself. And people are left almost like without a net. They just have to kind of go with the flow, and they don't know who to turn to, and they could get so much more support out there. And they need to know that. Doctors wield a lot of power. People put a lot of power into their doctors and physicians, and I think they need to use it a little bit more responsibly sometimes.
If they would just cut that medicine off or cut it down, slow it to something else, actually really find out what's going on, and then, yeah, maybe people have a chance.
Two months later, I go back to get tested. I'm in the green. I couldn't believe it.
Nice. Okay, that's discipline.
You know, I'm gonna join a gym. I have started eating healthy. I'm getting more sleep than I've ever gotten. I'm stepping back, breathing when I get scared. I am gonna continue on this new path. So,
Red lips and a bottle of pills help him through the day. White dress and suicide, thoughts of yesterday. Can't afford to live no more, and time is running out. If only he were a millionaire, in heaven he'd walk
Check, check,
around.
check, check, check. Did we unplug this? Okay, go. Check. Check, check.
Poverty may cause death, and money gives you life. Somber Mr. Franklin, buy you a surgeon's knife. Happiness may cause death, but don't worry, we'll prescribe a pill for that. The side effects are minor, just so you forget about that.
Success in pharmacy, as in any other profession, is achieved by diligence, persistence, and strict regard for professional ethics.